Hi, this is Delmar again. How are you guys doing today? I just wanted to make another quick video about my weight loss surgery journey. I plan on having gastric bypass surgery either in November or December of this year. I've gone through about 6 months of the diet and nutrition with because of my insurance. And another thing you have to do is, this is what I want to talk about today. You have to go and see a psychiatrist and a dietitian. And so I was a little worried. I didn't, they have this huge packet that you have to fill out. It has like 1,000 questions in there, and they ask you about, your history. Have you ever been abused? Why do you eat so much? Have you always been overweight? So on and so forth. And they ask you the same questions over and over again. So you can, and I guess so, if you lie, then they, hey, well, what's up with this? Your answers aren't matching each other. And so I answered all the questions in the packet. It took me about probably 2 hours to answer all the questions. And they ask you, what do you know about the weight loss surgery? What are the effects? What are the, different risks involved? What are complications that can happen? Why are you doing this? What have you tried in the past? And so they ask questions like that in the packet. And so I go over there, and it's like there's like 10 other people there, and it's like I was so uncomfortable because it was like it felt like a farm or something, a fat farm. No, but there were a lot of people there that, and I guess the specific place, it's called PsychMed, and I guess that's all they handle is they handle, psychiatric issues for people that have this, weight loss surgery. But I got a lot of information. It was kind of, I sat there. My appointment was, I think, scheduled for 9:30, and I was there until probably like 12 or 1. So I was there for a long time. And they weigh you, they check your blood pressure, and then they give you another set of questions. And this time it was 15 questions. No, it was 322 questions that you have to answer. And the questions, like, they ask you like the same questions like 5 or 6 times. And it's like, oh my gosh, it took forever for me to fill that out. Then they ask some other, questions. They just ask a whole lot of questions. And then, I sat there and waited. I guess the, psychiatrist reviewed the, how I answered the questions and so on and so forth. And so then I went and sat down with the psychiatrist person, and, he asked me, have you ever been abused? I was just reading over your, what different things you said. And of course I said no. And we just went through it, and he, it was very informative because I got a chance to ask him. I don't know if he had the surgery and stuff. He looked like he could have. He had a lot of loose skin around his stomach, but of course, I didn't ask him if he had that that surgery done. But I asked him different things. Like, there were a lot of different questions I had as far as, since your stomach isn't being used in the same manner that was before, is there a risk that you could get cancer later on? I had that question. Just questions about like 10 years from now, like what will I be like? Will I be, normal, or will, I still be, I don't know. I just, I think this is it's something that I want to do to help me in my weight loss journey, and I want to be healthy. I don't want to be overweight. I don't want to have to worry about dying from a heart attack or stroke or diabetes, so on and so forth. But at the same time, I don't want to be labeled my whole life as a gastric bypass patient. I want to move on with my life. I want to be normal. That's, the whole thing. And so he answered a lot of my questions. They have different support groups that they have where, after you have the surgery, they have like dance classes and different meetings and stuff like that. And I thought that, would be awesome, because I don't want to, and he was just, another thing he was telling me was that a lot of people that have the surgery, it's like they're food addicts. And so they eat and eat and eat because of different issues. And I guess that's why they ask you, have you ever been abused, and, different things like that, to see if that's why you're eating. And he said a lot of gastric bypass patients end up going into NA or AA because he said they trade one, a drug, which is food, for another one, a real drug. And he said also, whenever you drink alcohol, it's like it goes straight to your blood. It doesn't, it's not it doesn't, you don't digest it through your stomach. And so you get like a quick, high from that, or a quick, buzz. And, he told me, he said, be careful when you drink. And I don't drink. So, I didn't think that'd be too much of an issue. But I got a lot of knowledge from it. At first, I was a little scared because I'm like, oh God, I don't want to go to any psychiatrist. That's crazy. And I was scared he was going to analyze me and be like, oh, Mr. Tillis, we think you're crazy and you don't need to have the gastric bypass surgery. But, of course they didn't. He said I was a perfect patient for gastric bypass surgery. He said, I had a very supportive family and I had no, major issues, so on and so forth. And so it wasn't that bad. It was just very time consuming. And so, my advice to anyone that is having this surgery where you have to go to the psychiatrist is just be honest with them, because they're really going to help you. They're not there. That's because I thought they were there just to stop me or find reasons for me not to do it. But they're really there to answer questions for you, that you have about your mentality. Because, one thing that I have realized, like even losing weight already myself, I've already lost like 100 pounds. In my head, I'm still, 400 pounds. You know what I mean? I still feel the same way. And so, I think a lot of people struggle with that as well. And so that's what they're there for. Don't feel like you have to lie or hide your questions or, hide your issues. Just be honest with them, because that's what they're there to do. They're not there to help stop you, stop your surgery. So, just be honest and upfront and, ask all the questions you can. But it was a good experience. It was a good experience. But keep me in your prayers. Have a good day.